Strong Start, Dad's Role in Supporting Breastfeeding. Welcome to Strong Start, Dad's Role in Supporting Breastfeeding. The purpose of this series is to help you understand the value of your participation, opinion, and knowledge in the area of breastfeeding. These episodes are provided by the Division of Public Health, Community and Clinical Connections for Prevention and Health Branch, North Carolina Department of Health and Human Services. You can learn more at www.breastfeednc.com. We recognize and support all dynamics of loving families and gender-diverse lactating people around the world. However, for the purposes of this tool, we use gender-specific language related to the evidence of research in which the contents of this tool are based. Strong Start, Dad's Role in Supporting Breastfeeding. Episode 3, The Benefits of Breastfeeding. Many people know that breast milk is good for the baby, but some folks do not know that each mom's breast milk is made just for their baby. A mom's breast milk changes each day, week, and month to match the baby's needs as they grow or as their environment changes. When a baby is exposed to a virus or bacteria, mom's breast milk provides antibodies that help prevent the baby from getting sick, and even if they get sick, the illness can be less severe and for shorter periods. What mom makes for each baby is perfectly designed to help keep that baby healthy and growing. Even if mom has more children, her breast milk will be different for each child. Formula is a man-made product designed to mimic the nutritional components of breast milk. Formula is a standard product which cannot respond to each individual baby's environment, health, age, genetics, etc. While children do well on formula, research supports that breastfeeding leads to better health outcomes when compared to formula feeding. Even a little bit of breast milk is associated with greater health outcomes. One of the many important things about breast milk is that it grows with your baby. Mothers produce different types of ingredients in their breast milk as your baby grows. It is an amazing thing that when mom and baby are in sync, mom's body can produce exactly what the baby needs around the time the baby needs it. Let's look at how formula and breast milk stack up against each other. Both breast milk and formula have water, protein, carbohydrates, DHA, ARA, fats, vitamins, minerals, and both prebiotics and probiotics. Both formula and breast milk have these ingredients. Breast milk contains many ingredients that cannot be made in a factory and are integral to infants and young children's growth and development. Components that are exclusive to breast milk are anti-parasites, anti-allergies, antiviruses, hormones which promote growth and development, stem cells which fight disease, enzymes which aid in digestion and growth, growth factors that are important for growth and healthy development and may help preterm babies thrive, anti-cancers, which reduces the risk of many cancers in infants as well as reducing the risk of breast and ovarian cancer in breastfeeding mothers. Antibodies, to fight all kinds of infections and bacteria. And again, these ingredients are not only just present in breast milk, they are present when it is the most appropriate for your baby's needs. Breast milk provides not only more nutrition and immunity, but breast milk offers unique things that only mom can provide. And your support helps her start and continue to breastfeed longer. The longer she is able to breastfeed your baby, the more benefits for both mom and baby. This is why it is important for you to learn all that you can to learn and support mom in her breastfeeding journey. You can support mom and baby in breastfeeding, and both the baby and the mom can be healthier and stronger. Breast milk is made up of many components that help infants achieve their optimal health. Let's look at some of the components in a little more detail. Smart fats. About half of the calories in breast milk come from fats to help the infant's brain develop and absorb vitamins. Smart carbohydrates. Carbohydrates provide great calories for your growing baby, and there are up to 200 different sugars which provide energy and help grow the good bacteria that help regulate your baby's digestion, protect against certain infections, and keep your baby's diapers less stinky with healthy digestion. That is definitely a smart sugar. Hormones. Moms pass on hormones from her body in breast milk, and that provides benefits for both mom and baby. Some hormones help signal mom's body to continue to produce milk and help her feel relaxed while breastfeeding. One hormone, known as oxytocin, also helps promote bonding between mother and child. Studies have shown that some hormones in mom's milk may help regulate weight gain, obesity, and possible diabetes in babies later in life. All of these great things in breast milk provide great things for your baby. Babies can be healthy on formula, but formula makers cannot provide all of the great things in what mom provides, particularly over the full time that mom could breastfeed the baby. As we have already said, breast milk will change over time to meet the needs of a growing baby. There are three main phases of breast milk production. The first milk is known as colostrum. This is the thick first milk mom makes while she is pregnant and just after birth. Moms and doctors may refer to it as liquid gold for its deep yellow color and because it's so valuable for your baby. Colostrum is very rich in nutrients and has antibodies to protect your baby from infections. Colostrum also helps your baby's digestive system grow and work well. Colostrum is lower in volume but very high in nutrients. But it can concern new moms who think they have to be producing a large volume of milk in those first hours and days. Mom's body produces the right stuff at the right time. Colostrum is what the baby needs in those first few days. Colostrum has some very important antibodies that help protect your baby against infections and disease. These antibodies help babies develop a strong immune system and protect them from illnesses. Antibodies from mothers vaccinated against a specific disease-causing bacterium or virus can also be transferred via breast milk to babies. Because colostrum is concentrated and nutrient-dense, it is perfect amount for your baby's small tummy. This lower volume of colostrum also is expelled slower in the first days, and this makes it easy for your young baby to learn to suck, swallow, and breathe while breastfeeding. Colostrum also provides a laxative effect in those first few days to help the baby clear the first poop, known as meconium. Colostrum only lasts 2 to 5 days after birth, and then it slacks off to allow for a higher volume of transitional milk. But in those first crucial days, colostrum provides 2 times as much protein and 4 times as much zinc, which also prevents infections and provides building material for cells. Transitional milk comes when mature breast milk gradually replaces colostrum. Moms produce transitional milk from 2 to 5 days after delivery up until 2 weeks after delivery. You may notice that mom's breasts become fuller and that her milk slowly changes to a bluish white color. During this time, this breast milk changes to meet your baby's needs as well. Mature milk is what comes after the first couple of weeks. About 10 to 15 days after birth, mom starts producing what is called mature milk. Like each phase of breast milk, it has all the nutrients that your baby needs. The amount of fat in mature milk changes as mom feeds the baby. It is recommended that moms let the baby empty each breast completely, one at a time. The milk, even in one breast, has a different consistency from the beginning to the end of emptying the breast. This will help your baby get the right mix of nutrients at each feeding. This mature milk contains great things for your baby. Breast milk changes with your baby as they grow or as the environment changes. For instance, when they start childcare. Here is a timeline that explains some of these changes. Day 1, colostrum. Though small in amount, it is packed with exactly what the child needs to get a good start. Frequent feedings help mom build her milk supply in the early days. Look for signs of hunger and encourage feeding 8 or more times in 24 hours. day 3 to 5. Mom starts producing much more milk. Babies don't feed on a schedule, and there will be times when babies need to feed more often because of occasional growth spurts. You can encourage mom that she has sufficient milk and growth spurts are normal and to be expected. 1 month. The milk supply is established. Mom's milk supply doesn't change much between months 1 to 6 months, but the milk content changes to meet the baby's needs. At 6 months, the baby will begin to sit up and may start eating soft table foods, even though breast milk is the main source of calories. And then at 1 year, the baby can start eating table foods and continue to breastfeed as desired by mom and baby. After 1 year, the American Academy of Pediatrics and the World Health Organization recommends that baby be breastfed for 2 years or more. Breastfeeding beyond 1 year continues to provide infants with important nutritional and immunological benefits. We have discussed the makeup of breast milk and how it contains more beneficial factors than formula. We have discussed the different types of breast milk and how mom produces different amounts and content of breast milk over time. But what does it all mean? How does this impact the health of your baby? Your baby's health is the whole reason that supporting breastfeeding can be so beneficial for your baby. Let's look at the outcomes for breastfed babies. Breastfed babies have stronger immune systems. Breastfed babies have fewer colds and respiratory illnesses like pneumonia, respiratory syncytial virus, RSV, and whooping cough. Fewer cases of bacterial meningitis. Breastfed babies have fewer ear infections. Breastfed babies have better vision. Breastfed babies have less diarrhea, constipation, gastroenteritis, or gastroesophageal reflux. Breastfed babies have lower rates of infant mortality. Breastfed babies have lower rates of sudden infant death syndrome, also known as SIDS. Breastfed babies have less illness overall and less hospitalization, which means parents can miss up to 6 times fewer work hours. Breastfeeding benefits continue even after breastfeeding stops. Children who are breastfed report fewer instances of allergies, eczema, and asthma, fewer childhood cancers, including leukemia and lymphomas, a lower risk of type 1 and type 2 diabetes, fewer instances of Crohn's disease and colitis. Children who are breastfed report lower rates of respiratory illness, fewer speech and orthodontic problems, fewer cavities. Children who are breastfed are less likely to be obese later in childhood. And children who are breastfed have improved brain maturation. Because your baby is taking in these great things from breast milk, you can see all of the benefits for your baby. However, breastfeeding can also have a big impact on mom's health as she provides breast milk for your child. The practice of breastfeeding also has great benefits for mom. Breastfeeding is healthier for moms physically. It promotes faster weight loss after birth, burning about 500 extra calories per day. Less postpartum bleeding and chances of anemia. Breastfeeding stimulates the uterus to contract and return to normal size. Provides better sleep. Breastfeeding moms fall into a deep sleep quicker than non-breastfeeding moms. A more positive mood and less risk of postpartum depression. The bonding and time with the baby can also help mom's emotional health and well-being. There are many mental health benefits to mom breastfeeding the baby. Breastfeeding produces a naturally soothing hormone, oxytocin, that promotes stress reduction and positive feelings in the nursing mother. It increases mom's confidence and self-esteem. It increases calmness. Breastfed babies cry less overall and have fewer incidences of childhood illness. Breastfeeding can support the wellness of body, mind, and spirit for the whole family. Breastfeeding makes travel easier. Breast milk is always clean and the right temperature. Physical emotional bonding between mother and the child is increased. Breastfeeding promotes more skin-to-skin contact, more holding and stroking. Many feel that affectionate bonding during the first years of life help reduce social and behavioral problems in childhood and when they become adults. Breastfeeding mothers learn how to read their infants' cues, and babies learn to trust caregivers. This helps shape the infant's early behavior. There are also lifelong health benefits from the protective factors that may be developed for mom while she is breastfeeding. Breastfeeding moms may have these lasting health benefits. They may have a lower risk of breast cancer, a lower risk of ovarian cancer, a lower risk of rheumatoid arthritis and lupus. Breastfeeding moms may have less endometriosis, less osteoporosis with age, less diabetes, less hypertension, which decreases blood pressure, less cardiovascular disease. We wanted to show you the amazing things provided by breast milk and breastfeeding that your baby cannot get from a can. Mom has the perfect nutritional solution for your child, and even though babies can be healthy with formula, it just does not compare to the benefits of breast milk and breastfeeding with mom. Talk to your partner about how important you both think it is to breastfeed. Are you in agreement? Are there differences in your expectations? What other information do you need to make this important decision? Take these action steps. Breastfeeding is natural and free. Formula costs money. Research how much money you might spend for a month of formula. Check out all of these resources. You will find a full list of resources at www.breastfeednc.com/dads. Resources for this episode can be found in the podcast show notes or in the description of the YouTube video. We want your feedback. We want to know what is working and not working for you as a father from each of these episodes. Your feedback helps us to continue to provide good information for dads beginning their fathering journey. Go to www.breastfeednc.com/father-feedback and fill out a quick survey to let us know what is working and other ways we can help. Thank you for listening to Strong Start, Dad's Role in Supporting Breastfeeding. The purpose of this series is to help you understand the value of your participation, opinion, and knowledge in the area of breastfeeding. These episodes are provided by the Division of Public Health, Community and Clinical Connections for Prevention and Health Branch, North Carolina Department of Health and Human Services, in collaboration with Strong Fathers, Strong Families, LLC. Find additional episodes and resources for fathers at www.breastfeednc.com/dads. If your business or clinic is interested in a QR code cards that link to the Strong Start podcast to provide to new dads, please contact info@breastfeednc.com for more information.